Hey guys, so we know that the physician prescribed the patient with antiviral drugs. The patient has viral infection and has a family. Ano nga ba ang antiviral drug? It is not a medicine that cures viral infection, but rather decreases the ability of flu viruses to reproduce. Also, it may be administered orally, topically, or intravenously.
First in health teaching is explaining to the patient and to the family the dosage regimen. What is the dosage regimen? Information that are included in the dosage regimen or the dosage form of drug, schedule of doses, amount to be taken each dose, how the drug is to be taken, and the duration of how long you will take the drug. So we should emphasize that the patient should take the drug exactly as directed and for the full course of therapy. What if you miss a dose? Take the missed dose as soon as you remember, or if it is almost time for your next scheduled dose, skip the missed dose and do not take extra medicine to make up the missed dose. These are the possible side effects of taking antiviral drugs. When you urinate and see your urine like this, you should drink more water and go see your physician because you might have presence of crystals in your urine. Expect nausea and vomiting. Nausea is the feeling of an urge to throw up, while vomiting is the forceful expulsion of the contents of the stomach via the mouth or sometimes the nose. When you experience nausea, eat small meals or snacks throughout the day and eat slowly to keep from filling your stomach too quickly. Also, try to drink fluids at least 30 to 60 minutes before or after meals. And some complementary treatments such as ginger, acupuncture, and acupressure may help reduce nausea. And when you are experiencing vomiting, do not eat solid foods. Avoid drink fluids for at least 30 minutes after vomiting. Then start with small amounts of clear fluids every 10 to 30 minutes. This also helps to replace the fluid you have lost. And once you can drink fluids without vomiting, try small amounts of bland foods such as crackers and mashed potatoes, and return to eating a variety of foods as possible. Diarrhea. It refers to unusual loose or watery stools. To manage diarrhea, you need to increase the amount of liquids to 2 or 3 liters daily as tolerated. Also, eat foods that are low in fibers, such as potatoes, rice, and noodles. Also, limit food or beverages with caffeine. How can we know if the patient is experiencing anorexia? Anorexia is an emotional desire characterized by an obsessive desire to lose weight by refusing to eat. One indication of this is when you are thin and you want to lose weight because you think that you are fat. That's why the family can know if he or she has anorexia. And when the patient has anorexia, immediately contact the primary healthcare provider. For temporary relief of itching skin, stop taking the antiviral drug prescribed, moisturize daily, take a bath, and wear a lightweight clothing. Any reactions should be reported to the healthcare provider. We should also include inpatient and family health teaching to follow all directions on the medicine label and package. Treatment with antiviral drugs should be started as soon as possible after the first appearance of symptoms. Also, drink plenty of water to keep your kidneys working properly. And store the medicine at room temperature, away from moisture and heat. And wear protective gloves when applying the drug topically to decrease the risk of exposure to the drug and inadvertent absorption. We do health teaching to enhance patient knowledge about the drug therapy and to promote health. So that's it guys. If you like this video, hit the subscribe button and thank you for watching.